Hi, I'm Dr. Rebecca Schmidt from Northern Illinois Cat Clinic in Libertyville, Illinois, and Boots and I are here to talk to you about diabetes in the cat. Diabetes occurs usually for one of two reasons, either because the cat doesn't have enough insulin, make enough insulin, or because he's insulin resistant, or resistant to the own insulin that he's making, right? Insulin resistance is caused by infection usually, or also by obesity. So isn't that interesting? People are very similar to cats that way. So there are two different types of diabetes. There's type 1, where you don't have enough insulin, and type 2, where you are resistant to the insulin that you're making. So cats in general tend to have the type 2 diabetes. Obesity is probably the #1 cause for diabetes in the cat. When cats are overweight, they are more prone to becoming diabetic. The hormone insulin is made by the pancreas. There are little cells in the pancreas called islet cells, and they make insulin, and insulin is responsible for blood sugar being able to get into the cells, and the cells then use that sugar for energy. If the sugar can't get into the cells, then the blood sugar rises. So if there's not enough insulin, or if an animal is resistant to insulin, that blood sugar starts to rise. Well, when that blood sugar rises, then it causes it to spill over into the urine. And when sugar spills over into the urine, it creates larger amounts of urine. So then the cat begins to produce more urine, so the litter box gets wetter, and the clumps get bigger. People usually notice that. And also the cat becomes very thirsty. So they're drinking more water and passing more urine. And those are the typical signs of diabetes. Also, commonly the cats are losing weight. So if a cat is drinking more, passing more urine, and also is very hungry but seems to be losing weight, those are very often symptoms of diabetes. When a cat has the symptoms of diabetes and they come to see us at the cat clinic, very important, one of the first things that we do is a physical exam. And on the physical exam, we are looking for any complications that might make the cat more resistant to insulin. Something, for instance, like an infection. We're looking in the mouth, #1, because cats are very prone to dental disease. This is something that a lot of people don't know. So many cats have problems with their teeth and teeth infections, and the cats hide this. So this is something that we look for on our physical exam. We're also looking for any other complication, any other infection that the cat might have that we need to be able to clear up. Then, of course, we need to diagnose the fact that the cat is diabetic. The most important test is the blood sugar test. So we're checking to see how high their blood sugar is. So we do a panel of blood work that looks at a lot of different things, and that is the blood sugar. We're usually looking for a blood sugar that's over 300, because cats are really unique in the fact that if they get stressed, that blood sugar can rise, not from diabetes, but simply from adrenaline and from the stress. So we have to be very careful that we know it's not just a stress-related elevated blood sugar, but that the cat is really diabetic. So part of the blood work that we do is something called a fructosamine. The fructosamine looks back over the last 3 weeks. So rather than just that day that we're looking at that high blood sugar, we're also looking to see if the blood sugar has been elevated over the last 3 weeks. That's much more typical of a diabetic cat. We're also looking at liver enzymes. Diabetes can affect the liver in the cat. We're also looking at electrolytes on the blood work. Diabetes can alter the electrolytes. Those are things like potassium, sodium, chloride, also calcium and phosphorus levels. We're looking at those. We're also looking at pancreas levels, because one very common infection or inflammation that can encourage diabetes is something called pancreatitis. So there is a special blood test that will run to check the pancreas to see if it's inflamed as well. Because if the pancreas is inflamed, the islet cells can also be affected, and then they're often not producing enough insulin under those circumstances. Now, once we've diagnosed that the cat definitely is diabetic, and we've done our physical exam so that we know if there are infections that we need to take care of or any other problems associated with it, then of course we're working on treatment. Treatment in the cat is, of course, to get that blood sugar down. So there are oral medications that people take for type 2 diabetes, but those medications in the cat can cause serious problems with the liver, so they're not really safe. They can be used, but they're certainly higher risk. So in the majority of cases, cat diabetes is treated with insulin. So this means giving insulin injections, which we teach people how to do. And most people learn very easily how to give their cats insulin injections. Cats are much more tolerant of these injections than people think they're going to be. So that's usually the biggest thing people worry about, but it tends to be the least part of the problem as they become better at treating their cats for diabetes. The blood sugar needs to be monitored. This is done by taking a blood sample. So it can be done in the hospital, or it can actually be done at home. So we talk to our clients about how they can actually get blood sugars at home. So we would talk with you more about that. People say, well, how is that done? But we would talk to you more about actually getting blood tests at home, and the cat is so much happier to be at home. So monitoring that blood sugar, giving the insulin appropriately, giving the certain type of insulin that we determine based on the cat. There are different kinds of insulin to use. So that the cat determines what those are. And then also diet. Diet is extremely important. A lot of dry cat food over the counter is often high in carbohydrates. That can cause weight gain and cause obesity. So it's very important to go a prescription diet that is actually made to help prevent diabetes, or to even make diabetes become resolved, is made. That's the best one. There are also other diets that we can recommend if your cat doesn't happen to like that particular type of food. Basically an exam and blood work. A urine sample is extremely important because they can have urinary tract infections, or more prone to that. Then also going into the treatment with diet and also insulin and monitoring their blood sugar. Keep in mind that even this is not a simple disease. It's relatively complicated, but it's also very interesting, and the cats respond very well to treatment and to what the owners need to do. We highly recommend that you treat your cats for diabetes, and we are pleased here at Northern Illinois Cat Clinic to help you with that treatment, to help you get that diagnosis, and to get your kitty feeling better. Thank you.